Hi everybody, we're here with another edition of Phoenix Children's Live. This one is about epilepsy and seizure disorders. We are here with Dr. Angus Wilfong, the Chief of Neurology here at Barrow at Phoenix Children's, and an epileptologist. So please, as always, feel free to put your questions in the comments and we will get to as many as we can throughout the next half hour. Welcome, Dr. Wilfong.
Thanks, Molly. It's a pleasure to be here.
Great. So let's dive right in. Explain what the Pediatric Epilepsy Program at Barrow Neurological Institute at Phoenix Children's Hospital does, who it treats, and how it takes care of patients.
We have a comprehensive program here, and a comprehensive program means that we can diagnose and treat all kinds of epilepsy with all the treatments that are available anywhere in the world. We have available here at the Barrow Neurologic Institute at Phoenix Children's Hospital. We have a dedicated team of child neurologists that are specialized in epilepsy, like myself. So epileptologists have special additional training that is directed towards the diagnosis and treatment and management of epilepsy and other seizure disorders. Mm-hmm. And we have all the other specialty care that allows us a complete approach to taking care of the child and their family. That includes neuropsychologists, psychologists, psychiatrists, neuroradiologists, specialists in other specialized types of imaging with PET scans and SPECT scans. We have a dedicated epilepsy monitoring unit for children that helps us understand the type of seizures the child's having and what other kinds of treatments might be available.
Great. So if a person has seizures, does that mean that person has epilepsy?
Well, seizures are really common. About 1 in 10 people will have a seizure at some point during their lifetime. The times in our life when we're most likely to have seizures is in childhood and then when we get older. In fact, the commonest time to have a seizure at any time during our life is the first year of life. Seizures are due to an abnormal electrical discharge in the brain, and depending on where in the brain the discharge is happening and how much of the brain is involved will determine what that child's seizures look like. So seizures can look like almost anything, and there's about 30 different types of seizures. They can involve a blank staring spell to falling to the ground and being stiff and jerking in what is commonly referred to as having a convulsion or a grand mal seizure. That can be very frightening for families to see. About 1 in 26 people will have a tendency to have recurrent seizures over and over again, and that's what epilepsy is. So epilepsy means that someone is prone to having recurrent seizures, and that affects 1 in 26 people. That's very common. It's more common than most other neurologic conditions that people have heard about, like multiple sclerosis or Parkinson's disease or ALS or Alzheimer's. Epilepsy is more common than those conditions.
Wow.
And so that means there's about 3 million people in the United States right now that have epilepsy.
Wow.
So not everyone that has a seizure is going to have more than one. So some children will have just a single seizure, and those are usually triggered by something. So the commonest thing that triggers a non-epileptic seizure is having a high fever. And children between about 6 months of age and 3 years of age are really susceptible to having seizures triggered by a high fever, and those are called febrile convulsions. And that's not epilepsy. Those are seizures that are triggered by a high fever. And anytime a child is sick, or if they've had a mild concussion with a bump on the head, that can trigger a seizure, and that's different than having recurrent spontaneous seizures or unprovoked seizures. That makes epilepsy.
Interesting. So more people have it than we probably realize.
That's right, yes.
So you mentioned how common it was. Is it possible to outgrow epilepsy?
Yes, so one of the great things about childhood epilepsy is that children have a really pretty good chance of outgrowing their seizures. It's more likely for some types of epilepsy than other kinds of epilepsy, but there's really a very good chance that many children will eventually outgrow their seizures. Epilepsy tends to occur at different ages, so there are children that have seizures when they're a baby, and just have it when they're a baby, and then it goes away before they become school age. Other types of epilepsy begins in school age children and then goes away when they're teenagers. and other types start when they're teenagers and goes away before they become adults. Unfortunately, for some children, though, the seizures never go away and they develop lifelong epilepsy.
So, what are the different treatment options, not just for children, but as they grow older, who have seizures?
There are 4 main categories of treatment for epilepsy. We always start with medicines, and we have over 30 medicines that we use to treat epilepsy. Some medicines work better for some kinds of seizures and some work better for other kinds. If you look at everyone that has epilepsy, medicines work to completely control the seizures only about 60% of the time. Those aren't bad odds, but that still means that 40% of children and adults will continue to have seizures no matter which medicines you use. And those people are referred to as having medically intractable, medically refractory, or treatment-resistant epilepsy. We can predict pretty quickly about who's going to respond to a medicine and who isn't. So we know that if a child has failed to have their seizures come under complete control after 2 medicines, it's very unlikely that additional medicine trials will make that child seizure-free. So once a child has been determined to have intractable or refractory epilepsy, there are 3 other treatment possibilities. The best treatment for uncontrolled epilepsy, if it's possible, is doing an operation on the brain. Many times children's seizures are coming from a very defined area of the brain, and if we can identify that area, many times we can surgically remove it or destroy it with a laser, and by taking that little spot in the brain away, that can cure the epilepsy. And it's always best, if it's possible, to be able to cure any condition rather than just try to manage it. However, there are many reasons why surgery might not be a possibility. Some children have seizures coming from multiple places in the brain, and we can only really operate on one place. And if the seizures are coming from both sides of the brain, then surgery usually isn't a possibility. Some children have generalized seizures where the seizures come from everywhere at the same time, and surgery is not a possibility for them. And then occasionally children have seizures coming from a critical part in the brain that we just can't safely do surgery on without producing a handicap, and we never want to be able to do that. So if a child has seizures coming from the language or speech center, or from a vision center or a memory center, then we usually don't do surgery. So for children that have uncontrolled seizures and they're not a candidate for having surgery, there are 2 other treatment possibilities. One special food that you eat called the ketogenic diet, and we have 2 dedicated, very experienced ketogenic dietitians and have really a wonderful ketogenic diet program here. And there's the traditional ketogenic diet, and there's also variations of the diet. One is called the low glycemic index diet, and the other is the modified Atkins diet. And those diet therapies can really have a big impact on helping control seizures. And then for other children, there's an electrical pacemaker therapy with a small little pacemaker, similar to a heart pacemaker, that gets implanted under your skin, and that stimulates a nerve on the left side of your neck called the vagus nerve, and that therapy is called VNS, or vagus nerve stimulation therapy, and that can be very effective in controlling seizures in children where surgery is not a possibility.
Sure. So we use all 4 of those treatments here
Absolutely.
at Phoenix Children's. So when a child has seizures, how is it determined what kind of seizures they are?
Well, there's important tests that help us understand where the child's seizures are coming from and what the underlying cause may be. There are many different reasons why a child might develop epilepsy. One of the commonest reasons is a genetic cause, and children can have a genetic cause for their epilepsy without it running in the family.
Oh, interesting.
So each child is a unique combination of genes, half coming from the mother's side of the family and half from the father's side of the family. And there might not be the right combination in either parent to have epilepsy, but that unique combination that came together to create their child could give that child a combination of genes that produces seizures.
Interesting.
So usually children with a genetic form of epilepsy have normal MRI scans and a very specific pattern on their EEG that tells us that it's a genetic epilepsy. So the 2 most important tests that a child needs when they have epilepsy is an EEG, which is an electroencephalogram, and that's an electrical recording of the brain activity. And a standard EEG is done as an outpatient test, and it takes about an hour, and it's very easy to do, and the child just has little electrodes that are glued to his skin, and we record the brain waves for about an hour. And many children who have epilepsy have a certain pattern of little electrical discharges in the brain that signify the type of epilepsy that they have. And then we also want to do an MRI scan, and an MRI takes very detailed pictures of the brain anatomy, and some children have physical anatomic reasons for developing epilepsy, like a small scar on the brain or area of the brain that didn't grow or develop normally. So those are the basic tests that we need for all children that have epilepsy. For children that have difficult to control epilepsy or are being evaluated for possible surgery, we need to record the actual seizures. And children, may have many seizures a day, and some children can have hundreds or even thousands of seizures a day.
Wow.
But most of the time, children are having a seizure a week or maybe even just a seizure a month, and we're not likely to capture those seizures on a regular 1-hour EEG.
Sure.
So in order to be able to record those seizures, we need to bring them into the hospital into a very specialized unit that we call the Pediatric Epilepsy Monitoring Unit. And that's staffed by specially trained nurses, and myself or one of my partners in epilepsy are the doctors that are working in that unit. And we have specialized technologists that monitor the child 24 hours a day. And we put the EEG electrodes on, and we record the child 24 hours a day for as long as it takes to be able to record and capture the seizures. Sometimes that takes just a day, sometimes it takes a week, sometimes it takes even longer than that. But being able to map out and record exactly where the seizures are coming from when they're occurring helps us determine the type of epilepsy and specifically where in the brain the seizures are coming from.
Interesting. And we have the only pediatric epilepsy monitoring unit in the Southwest.
That's right. And we're the only center that does brain surgery on children with epilepsy in the entire region. So we're the only ones in Arizona, New Mexico, and Nevada that provide that therapy.
That's wonderful. So when a family is in the unit, how does that work? Is it just kind of sitting around all day waiting for a seizure to happen?
Well, the child can get out of bed and move around the room, and we encourage one of the family members to stay with the child. And there's it's a private room that's big enough, and there's a pull-out couch for mom or dad, a caregiver, to sleep there. And the child is on camera, and the camera moves around the room with the child. And we have night vision cameras so that we can turn the lights out at night and we can still see the child in the dark. And we want to be able to see exactly what the child does when a seizure occurs, and at the same time we're recording the brainwave activity. Otherwise, the child needs to pretty much stay in the room, but they can watch TV, they can do schoolwork. We have child life specialists that can come and do different kinds of activities, and we have school at the hospital too, so the children can continue with their schoolwork while they're in the hospital.
Great. So soon, Barrow at Phoenix Children's will have a new minimally invasive laser treatment. Can you explain how that works, what it is?
We're always looking for new, better, and safer ways to do surgery of all kinds of surgery. And there's been recent major advances in neurosurgery and able to offer that type of minimally invasive surgery. And I was the innovator that developed a new laser technology that we use for epilepsy surgery. And this is now used in most major epilepsy centers around the United States. And we have it here now at Phoenix Children's Hospital at the Barrow Neurologic Institute. And this is really a wonderful therapy that we can do for some children who have epilepsy that are candidates for epilepsy surgery, but not all. A traditional epilepsy surgery requires us to open the skull and expose the brain, and then the surgeon removes the part of the brain that's causing the epilepsy surgically. With the laser, the opening in the skull is only 3 millimeters, so about the size of your pencil lead, and we do the surgery in the MRI scanner with the MRI scanner running. So we have the three-dimensional precision of knowing exactly what's happening because we're looking at the child's brain in real time on the MRI scanner. Mm-hmm. And then through a very tiny laser catheter, which is only 1.6 millimeters, that gets placed in the child's brain, we heat up the tip of the laser and we can watch it destroy the target that's causing the epilepsy with really extreme precision. And the actual destruction of the spot that's causing the epilepsy takes about 60 seconds.
Wow.
And the vast majority of children that get laser surgery are able to be released from the hospital the next morning.
Which is dramatically less time in the hospital.
That's right. Most children with a regular brain surgery that requires opening of the skull need to spend 5 to 7 days in the hospital, and this is just an overnight stay.
Wow. So this is pretty great.
It's really exciting,
yeah.
And it really offers us a new approach to very precisely cure epilepsy.
Yeah, that's great. So it looks like we have a question from a viewer. How does my child deal with absent seizures? Maybe we start by saying what absent seizures are.
So as I said earlier, there are a lot of different kinds of seizures, and absence is one specific type of seizure where children have blank staring spells. So during an absence seizure, they usually last 5 to 10 seconds in duration, and a child has an instantaneous interruption of their consciousness. Absence seizures are the only type of seizure where you're completely unconscious and you don't fall down. So although the child's brain is completely asleep, their eyes stay open and they can stay standing, but they stop what they're doing. So they would stop and stare in the middle of a sentence or any kind of an activity, and we can see those seizures on the brain, and they involve all of the brain. And then as soon as the seizure ends, the child snaps out of it and immediately goes back on to doing whatever they were doing.
Interesting.
Before children get treated, they're usually having hundreds of those little staring spells every day.
Oh, wow.
And sometimes people are thinking that the child is daydreaming or just not paying attention. And so sometimes there's a little bit of delay in realizing that the child is having staring spell seizures rather than just behavioral inattentiveness. Absence seizures are one of the genetic inherited types of epilepsy. So in general, children with absence epilepsy have normal development and have normal MRI scans. And the seizures are usually fairly easy to control. The challenge, though, with absence epilepsy is that we only have really 3 medicines that work particularly well for that type of epilepsy. Although we have over 30 types of medicine for other kinds of epilepsy, we only have 3 main ones that work well for absence epilepsy. So if a child has a reaction to one and doesn't respond to another, pretty soon you're down to just one medicine that might work for that. And if medicines don't work for controlling the absence seizures, the brain surgery is not a possibility, but the ketogenic diet or variations of the diet can work, and the electrical pacemaker, the vagus nerve stimulator, can also work well for absence seizures.
Sure. And I do want to say we could have a whole talk about ketogenic diet. So we have more information on our website at barrow.phoenixchildrens.org. Looks like we have a follow-up to that question too. How do we keep those absence seizures under control?
Well, getting on the right medicine.
Yes.
And then making sure the dosage is correct. And if that medicine doesn't work, then transitioning to one of the other medicines that work. The 3 medicines that work best for absence seizures are Lamictal is the brand name, lamotrigine is the generic name, Zorantin or ethosuximide is the second one, and the third one is Depakote or valproic acid. And those are the 3 medicines that tend to work best for absence epilepsy.
Okay. Perfect. So another one, would the laser procedure work on patients with, maybe you can say those words?
Periventricular nodular heterotopias.
Perfect.
So periventricular, which means that these are little nodules that are along the fluid cavities inside the brain. So they're periventricular nodular because they're little nodules, heterotopias. And a heterotopian is a part of normal brain tissue that's in the wrong place. And these are very, very deep in the brain. And we don't typically do traditional brain surgery for that because they're so deep, so difficult to get to, that you would have to sacrifice completely normal brain in order to get down to them. And the laser is perfect for that. So that's actually one of the conditions that I developed this technology in order to be able to treat. And we can put the laser catheter into the heterotopia and destroy them very precisely, and it works very well for that.
That's great. Because we should say you did help develop this technology that
That's
we're
right.
using here at the hospital.
That's right.
That's wonderful. So on April 29th, we are hosting with the Epilepsy Foundation of Arizona a community event for parents and family members of children with epilepsy and seizure disorders, which you'll be a part of.
That's right.
So can you talk a little bit about what you'll be discussing there?
So this is a family caregiver community-oriented conference where we have experts in epilepsy that are talking about different treatment options for families. So I'd encourage anyone that has an interest or their lives have been touched by someone with epilepsy to come to the conference. It's free. It's just right across the street here in a nice conference center, and it'll give you the opportunity to hear and learn about the latest, newest treatments for epilepsy, and also meet and talk to other families that are dealing with epilepsy as well. So I'm going to be talking about the electrical pacemaker therapies. We refer to those as neuromodulation therapies, so that includes the vagus nerve stimulator as well as some direct brain stimulation techniques that we use to manage epilepsy.
Great. And just so you know, we will put a link to that event. You can RSVP ahead of time. So at the end of this, we will put a link to that in the comments. So moving kind of back into sort of what life is like for children or adults even with epilepsy, can they live a normal life if they have seizures?
Yes, if their seizures are controlled. In fact, if you have well-controlled epilepsy, there's really almost nothing that you can't do. I have people that I've trained as well as that I know personally that are physicians of all different kinds, including I know a couple of people that are epilepsy doctors that have epilepsy themselves.
Interesting.
But it's important to have the seizures under complete control. For if you don't have seizures under complete control, then you can't have a driver's license, and you would be at risk of having accidental injury and even dying with an accidental injury. And drowning tragically still remains one of the commonest causes of death amongst people with epilepsy. If they have a seizure when they're in the bathtub and no one else is around, it can be really tragic. One of the biggest challenges with living with epilepsy is just not knowing when the next seizure is going to occur. And it's the unpredictability of seizures that makes living with epilepsy such a challenge. And it's why it's so important to get the seizures under control. And if you have difficult to control epilepsy, making sure that you're taking it to the top level and getting a complete evaluation and understanding what all treatments might be available for that individual to get the seizures under as best control as possible. And if that person or child is a surgical candidate, seeing if they could have their epilepsy cured with a surgical procedure.
Interesting. So we have another question, and I'm struggling with it a little bit. What causes Chiari Malformation 1? Now, Chiari is another neurological related disorder. Is it related at all to epilepsy?
No. So Chiari Malformation is not associated with epilepsy.
Okay.
And it's where there's a malformation right at the base of the brain, right as it passes through the opening where it connects with the spinal cord. And part of the balance control center of the brain, which is called the cerebellum, gets drawn into the opening with the spinal cord. And in some patients that can cause compression of the spinal cord, and that can give headaches and other kinds of symptoms. And for severe cases of a Chiari malformation, surgery is required to open up the opening down to the spinal cord, called a decompression. And there are surgeons here that are world experts in doing that surgery. So if somebody has a Chiari malformation, the neurosurgery folks here at BNI at Phoenix Children's would be the people to see.
Okay, so it's a little bit related. We hear you loud and clear. We will probably have a Phoenix Children's Live about Chiari malformation, but you can probably find more information on our website. So if a parent thinks their child is having seizures, or maybe that those staring spells are happening and they're just not quite sure what's going on, how do they get an appointment with our team?
Well, it's easy to get access to our team here. Our team of general neurologists. We have subspecialists in every area of neurology, and we have a dedicated epilepsy team. There's 5 of us right now. There's soon going to be 7 in our team, and so we're growing and expanding and making access easier and easier. For children that are really having problems, we would see a child right away. If the family doctor or a referring doctor calls us, we can get that child worked in. For children that have new onset, you're wondering whether your child might have epilepsy or perhaps seeking a second opinion, just give us a call, and we have schedulers that are ready to answer the phone and get your child scheduled. So the phone number for neurology is 602-933-0970, and option number 2 takes you right to our scheduling people, and they're there to answer the phone. You don't have to leave a message and wait for a phone call back. They'll take your call and get things set up right away.
Great. So we will put that number in the comments as well. Don't forget, option 2 will get you to our schedulers. Well, I think we've hit most of the high points. We're looking forward to seeing everyone at the epilepsy event on April 29th. Thank you so much, Dr. Wilfong, for joining us today.
Thanks so much, Molly. It was a pleasure to share some time with you.
Yeah.